I want to talk to you today about something that drives a great many older adults to genuine distraction, often quietly, often at night, and that they rarely think to mention to anyone. Persistent, maddening itching of the skin, sometimes with no rash, no bite, no obvious cause at all. You scratch, and it helps for a moment, and then it's back, or it moves somewhere else. It's worse in the evening, worse in bed, worse after a warm shower. It can disturb your sleep, leave your skin raw and scratched, and wear down your patience and your mood. And here's the thing. This kind of itching, what doctors call pruritus, becomes far more common as we age, and most of the time it has a perfectly understandable, manageable cause. But occasionally, persistent itching can be your body's way of signaling something else going on inside, something worth identifying. So today, I want to explain why itching becomes so common as we age, what the usual harmless causes are, how to soothe and prevent it, and, importantly, when itching is worth taking to your doctor because it might be telling you something more. And I'll keep this calm and honest throughout, because most itching, while genuinely miserable, is not a sign of anything dangerous, and there's a great deal you can do about it. Let me start with by far the most common cause of itching in older adults, because understanding it explains most cases and points straight to the solution: dry skin. As we age, our skin changes in ways that make it drier, and dry skin is itchy skin. Let me explain what happens, because it makes everything else make sense. Your skin has a natural barrier, a layer that holds moisture in and keeps your skin supple and protected. As we get older, the skin produces less of the natural oils that maintain this barrier. It holds less moisture. It becomes thinner, and it renews itself more slowly. The result is skin that's drier, more easily dehydrated, and more prone to that tight, flaky, itchy feeling. This age-related dry skin is extremely common, and it's the leading cause of itching in older adults. And many ordinary things make it worse. Hot showers and baths, which strip the skin's natural oils, harsh soaps and detergents, dry indoor air, especially from heating in winter, low humidity, and not moisturizing. So if you're an older adult with itchy skin and no obvious rash, the single most likely explanation by far is simply dry skin, made worse by hot water, soap, and dry air. And the good news is that this is very manageable once you understand it. Winter itching in particular, that seasonal misery when the heating goes on and the air dries out, is classically this dry skin itch. So let me give you the practical ways to soothe and prevent dry skin itching. Because for most people, this is the answer, and it genuinely works. First and most important, moisturize. Regularly and generously. Use a good, thick, fragrance-free moisturizer, a cream or ointment rather than a thin lotion for very dry skin, and apply it at least once or twice a day. And crucially, apply it right after bathing while your skin is still slightly damp, because that traps the moisture in. This single habit, regular moisturizing, resolves a great deal of itching. Second, change how you bathe. Use warm rather than hot water, because hot water strips the skin. Keep showers and baths shorter. Use a gentle, fragrance-free, moisturizing cleanser instead of harsh soap, and don't scrub. And pat your skin dry gently rather than rubbing, then moisturize immediately. Third, address the air. In dry seasons or with heating running, use a humidifier to put moisture back into the air, which helps your skin hold its own moisture. Fourth, choose soft, non-irritating clothing, avoiding rough wool and harsh fabrics against the skin, and use fragrance-free, gentle laundry detergents, since residue can irritate. Fifth, stay hydrated by drinking enough fluid, which supports your skin from within. And sixth, avoid the urge to scratch as much as you can, because scratching damages the skin and sets up an itch-scratch cycle, where scratching causes more irritation and more itching. Keeping nails short and applying moisturizer or a cool compress when the urge strikes helps break that cycle. For the great majority of older adults with itchy skin, these simple measures, especially diligent moisturizing and gentler bathing, bring real relief. Now let me turn to the other causes, because while dry skin is the leading one, itching has a number of other possible explanations, some of them worth knowing and a few worth taking to your doctor. Let me start with the skin-related ones. Eczema and dermatitis, inflammatory skin conditions, cause itching, often with redness, dryness, or a rash. Allergic reactions and contact dermatitis from something your skin has reacted to, a new soap, lotion, detergent, plant, or metal, cause itching, often where the contact happened. Hives cause raised, intensely itchy welts. There's a common condition in older adults where the skin on the lower legs becomes dry, scaly, and itchy. And, importantly, certain skin infestations cause itching. Scabies, a mite infestation, causes intense itching that's classically worse at night and can spread in households and care settings, and it's very treatable once recognized, so it's worth knowing about because it's sometimes missed. So a good number of itching cases are due to identifiable skin conditions, many of them treatable, which is one reason a persistent or rashy itch is worth showing to a doctor who can actually look at it. Now let me come to the part that matters most for understanding when itching might be telling you something more. Because this is the genuinely useful knowledge. Sometimes, persistent itching, especially itching all over the body without an obvious rash or skin cause, can be a sign of an underlying internal condition. I want to introduce this calmly because it's the less common situation, and I don't want to alarm you, but it's important. When the itch is widespread, persistent, and not explained by dry skin or a visible skin problem, doctors consider whether something internal might be causing it. Let me tell you the main possibilities. Thyroid problems. Both an overactive and an underactive thyroid can cause itching. Kidney disease. When the kidneys aren't clearing waste properly, can cause significant generalized itching, which is a well-known feature of advanced kidney problems. Liver and bile problems can cause itching, sometimes intense, and this kind may come with other signs like yellowing of the skin or eyes, dark urine, or pale stools. Iron deficiency can cause itching. Diabetes can be associated with itching. Certain blood conditions and, less commonly, some other serious conditions can cause persistent generalized itching, sometimes even before other symptoms appear, which is exactly why unexplained, persistent, whole-body itching deserves a proper evaluation. And finally, medications are a common and overlooked cause. Many drugs can cause itching as a side effect, so if your itching began after starting a new medication, that's worth mentioning to your doctor. So while most itching is dry skin, persistent generalized itching without a skin cause is exactly the kind of thing that occasionally points to a treatable internal condition, which is why it's worth a doctor's attention rather than just endless scratching. Let me be very clear and balanced about this, because I never want to send you into needless worry, and the reassurance is genuine. The overwhelming majority of itching in older adults is dry skin or another benign, manageable skin cause, and it is not a sign of anything serious. So please don't read this and assume your itchy skin means something is wrong inside. Far more likely, it means your skin is dry and needs moisturizing and gentler care. The point of knowing about the internal causes is not to frighten you, but so that you recognize the specific situation that warrants a check. Itching that is persistent and doesn't respond to good moisturizing and skin care. Itching that's all over your body without an obvious rash or dry skin explanation. Itching that's severe enough to disrupt your sleep and life. Or itching that comes along with other symptoms like yellowing of the skin or eyes, unexplained weight loss, fatigue, fever, night sweats, or other changes. Any of those patterns is a reason to see your doctor, calmly, to look for an underlying cause, while the common dry skin itch can simply be treated with good skin care. So the framework is, try good skin care first, and see your doctor if the itching is persistent despite that, is generalized without a skin cause, is severe, or comes with other symptoms. Let me say a bit more about what to expect if you do take persistent itching to your doctor, because knowing makes people more willing to go. The doctor will ask about the itching, when it started, where it is, what makes it better or worse, and about your skin care, your medications, and any other symptoms. They'll look at your skin to see whether there's a skin condition causing it, and if the itch is unexplained, persistent, and generalized, they may do some simple blood tests to check things like your thyroid, kidney, and liver function, your blood count and iron, and your blood sugar, looking for any internal cause. Most of the time, this either confirms a benign cause or finds something straightforward and treatable. The path is gentle, mostly a conversation, an examination, and perhaps some simple blood tests, and the point is to either reassure you and treat your skin, or to find and address any underlying cause. There's nothing to dread in getting persistent itching checked, and a good deal to gain, whether it's effective treatment for your skin or the catching of something worth catching. Let me say a word about the toll itching takes, because it's often underestimated, and that toll is itself a reason to address it rather than suffer. Persistent itching, especially at night, can seriously disrupt sleep, and poor sleep affects everything: your mood, your energy, your health. The constant urge to scratch is genuinely distracting and distressing, and scratching damages the skin, causing raw areas, sores, and sometimes infections, and setting up that vicious itch-scratch cycle. Chronic itching can wear down a person's mood and quality of life considerably, more than people who haven't experienced it realize. So itching is not a trivial complaint to be brushed aside. It deserves real attention and real relief, both for comfort and because the underlying cause, whether dry skin or something internal, is worth addressing. You don't have to simply endure it, and you shouldn't. Let me paint you a picture of how this commonly plays out, because I think it captures the usual story and the sensible response. Picture a man in his 70s who, especially in winter, develops itching all over, worst in the evenings and in bed, with no obvious rash, just dry, slightly flaky skin. It's disturbing his sleep and driving him to distraction, and he's started to worry that something must be wrong with him. He's been having long, hot showers, which feel soothing at the time, but actually dry his skin further, and using a harsh soap and not moisturizing at all, and his home is warm and dry from the heating. He learns what you're learning today, and he makes simple changes. He switches to shorter, warm showers with a gentle cleanser, moisturizes generously twice a day and right after showering, runs a humidifier, and wears softer clothing. Within a couple of weeks, the itching largely settles, his sleep improves, and his worry dissolves. It was dry skin all along, very manageable once he understood it. Now picture a different version, where the itching is all over, persistent, doesn't respond to good skin care, and comes with fatigue and some yellowing he hadn't quite noticed. In that version, he sees his doctor, who does some blood tests and finds an underlying condition that needed attention, caught because he didn't just keep scratching and assuming. In both cases, the right response was the same. Treat the skin well first, and see the doctor if the itch persists despite that, or comes with other signs. That's exactly the calm, sensible path I want for you. And let me speak directly to those of you caring for or close to an older person, because itching is something they may not mention, and you can help. You might notice a loved one scratching frequently, having scratched or raw areas on their skin, sleeping poorly, or seeming irritable and distracted by discomfort. Itching is easy to dismiss, but genuinely affects quality of life and sleep. You can help with the simple, effective skincare, making sure they're moisturizing regularly, especially after bathing, helping them switch to gentler cleansers and warm rather than hot water, running a humidifier in dry weather, and choosing soft clothing and gentle detergents. You can keep their nails trimmed to limit the damage from scratching. And you can encourage a doctor's visit if the itching is persistent despite good skin care, is all over without an obvious cause, is severe, or comes with other symptoms like yellowing, weight loss, or fatigue. Because in those cases, it's worth looking for an underlying cause. You can also help review their medications with the doctor, since some cause itching. For someone with dementia who can't easily express what's bothering them, unexplained restlessness, agitation, or scratching may be the itch of dry skin or another cause, and treating it can bring real comfort. That kind of attentive, practical care relieves a genuinely distressing problem. Let me draw this all together. Persistent itching becomes far more common as we age, and by far the most common cause is dry skin, because aging skin produces less oil, holds less moisture, and is thinner, made worse by hot water, harsh soap, dry air, and not moisturizing. For most older adults, this dry skin itch, while genuinely miserable and disruptive to sleep, is benign and very manageable with good skincare. Regular, generous moisturizing, especially after bathing, warm rather than hot water, gentle cleansers, a humidifier, soft clothing, and breaking the itch-scratch cycle. Itching can also come from identifiable skin conditions like eczema, dermatitis, allergic reactions, and treatable infestations like scabies. And occasionally, persistent, generalized itching without a skin cause can signal an underlying internal condition, such as thyroid, kidney, or liver problems, iron deficiency, diabetes, certain blood conditions, or a medication side effect, which is why itching that's persistent despite good skin care, generalized without a rash, severe, or accompanied by other symptoms, deserves a calm visit to your doctor, who can examine your skin and run simple blood tests if needed. The overwhelming majority is dry skin, but the persistent, unexplained kind is worth checking. So here's what I'll leave you with. First, understand that itchy skin in older adults is most often simply dry skin, very common and very manageable. So the first and most powerful response is good skin care. Moisturize regularly and generously, especially right after bathing. Use warm, not hot water and gentle cleansers. Run a humidifier in dry air. Wear soft clothing and try not to scratch. Second, give that good skin care a fair chance, because for most people, it brings real relief. Third, see your doctor if your itching is persistent despite good skin care, is all over your body without an obvious rash or dry skin cause, is severe enough to disrupt your life and sleep, or comes with other symptoms like yellowing of the skin or eyes, unexplained weight loss, fatigue, fever, or night sweats, because in those situations, it's worth looking for an underlying cause that may be treatable. Fourth, mention any new medication to your doctor as a possible cause. And don't dismiss itching as trivial, because it genuinely affects sleep, comfort, and quality of life, and deserves relief. Itching is miserable, but it's almost always manageable. And on the rare occasions it's signaling something more, that's exactly why catching it matters. So take care of yourself, care well for your skin, and don't hesitate to see a doctor if the itch persists or comes with other signs. And because only a doctor can examine your skin and check for any underlying cause, please treat persistent or unexplained itching as your reason to get checked by your own physician, who can find the cause and help, rather than as a substitute for that visit.